Hello, my name is Irene Pisano, and like I said, I'm gonna go ahead and do my re-med verification video. Now I'm gonna do on my intramuscular medicine. Like I said, this is Miss Sally, my patient, and her call light. I'm gonna use this to inject her injection, and as well, I already have. I'm also gonna use this MAR. This is what I'm looking at. The MAR Dr. Smith provided her PowerPoint notes, and this is my med cards. All right, so let's get started. I'm looking at the MAR, and my provider ordered some morphine 2 ml, morphine sulfate 2 mLs for my patient. I'm looking at the MAR. She does have allergies. She's allergic to bee stings, statins, and insects. For my medication, there's no contraindications. Due to the drug book, she's within the right weight, age, and physical conditions. I'm now gonna go ahead and look at the MAR again, and I'm gonna, make sure I'm gonna pull the right medication. Gonna wash my hands. I'm gonna pull my medication out, the morphine out. Now, before doing anything, I'm also gonna go ahead and look at the expiration date, and I'm gonna double check that I got the right medication for the right patient. The right patient med dose route and time for my documentation, as well as 6 rights for my patient. Like I said, I'm gonna go ahead and scan it, and I look at the expiration date. I'm now gonna go ahead and grab my other supplies. Sorry. Okay, so let's start. So now I'm in the room. Knock, knock. Hello, Miss Sally. My name is Irene. I'm going to be your nurse today. Can I get your name and date of birth and your last name as well? Sally Doe, 11/17/97. Okay. Sally Doe, 11/17/97. Okay. So your doctor ordered you some morphine, sulfate. This medication is basically used it's a narcotic that's gonna release some of the some chronic pain that you're having. Some side effects that you can feel is shallow breathing, constipation, nausea, vomiting, respiratory depression. But I'm gonna be here with you I can make sure you don't have no problems. And if you do, please let me know. I'm now gonna go ahead and I'm just gonna ask you. I looked at the MAR and it says you do have some allergies. Okay, you do. All right, can you name for me? Yeah, bee stings, statins, and insects. Okay. Well, this is not going to there's no contraindications with the medication I'm gonna give you. So, any questions? No? Okay. So, I do gotta say the intramuscular injection, you're able to give it in a deltoid, the vastus lateralis, and the ventral gluteal. If I were to do the ventral gluteal, I will place my hand I will lay my patient first on the side or on the back, place my hand on the heel, find the greater trochanter. I will find the iliac crest with my thumb. Oh, well, let me just do it here. Okay, with my thumb, and then my index finger will be among the iliac crest, and then between my fingers, my V fingers, I will give the injection. The vastus lateralis is below my hip and above my knee, and the deltoid is basically you find the cranium process, and it's gonna be 3 fingers. You can use 3 fingers and then to give the injection. So I'm gonna do the deltoid, and like I said, I'm gonna find the aquarium process. Mine will be like right here. From use 3 fingers. 1, 2, 3, right here. So I'm gonna say like right here for my deltoid injection. I'm first gonna go ahead and look at the skin, make sure there's no redness, taleness. I'm gonna palpate. I don't feel no hardness. All right, so I'm gonna go ahead and get started. So, well, it is an alcohol wipe. Okay. All right, so I'm gonna go ahead and put some gloves on. My hands are washed, put some gloves on, and I'm gonna clean the valve for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. I'm gonna let it dry for 10 to 15 seconds. I'm gonna go ahead and, like I said, I'm gonna get my injection. This is a new alcohol pod. I'm gonna clean my area, my patient too. 2, 5, 7, 8, 9, 10. Okay, and I'm gonna let it sit dry. While that's drying, I'm then gonna go ahead and pull my medication. What if I can open this? Okay. I have gloves on and my hands are clean. I'm not breaking Serofield because if that were to happen, I will have to start over again. Okay. And my vial is already dried. And like I said, I'm gonna pull 2 mLs of hold on, it's not phone switch hard. Yeah, it's okay. Of morphine. Okay. 2. All right. I already aired my syringe. I'm gonna pull the air in. Making sure there's no air bubbles. Okay. Okay. All right, since I already cleaned my site, because this is her arm, I'm gonna give my injection, like I said, in the deltoid. I'm gonna give it a 90-degree angle. I'm the disease track method, put the fat to the side. Well, sorry. So 7 out of 10. Okay. I will not recap this needle. Sorry, my dad's calling me. I will not recap this needle. I will just throw it in the syringe box. I will give my call out to the patient. Okay, Miss Sally, I gave you your morphine. Please let me know if you have any questions. Your head's okay, you're good, okay. Here's your call light. Like I said, let me know if you have any questions. I will dispose of my stuff, throw it away. And like I said, I already got rid of my needles. I will then document my how the patient tolerates side effects or any complications, and that will be it. Thank you.